Good afternoon, Dr. Ted Blum. How are you?
I'm okay, Penny. Thank you. And
Good.
yourself? You doing all right?
Life is good, thank you. I have some complaints, but so does everybody else. Everyone's got them. So, thank you so much for doing this for the UJC. Thank you for being part of this outreach effort. And I would just really like to start with, so what do you do on a daily basis? What's your normal day job?
What I try and do is maintain the practice with as much normalcy as possible in a time of abnormality.
So
So
just to
we,
confirm, you have a private practice in primary care
I
in Bethel,
have a
right?
practice in family medicine, and I have been practicing in Bethel for over 40 years now. And during this time, we have done our best to keep the office open, to be available for patients, and to try and provide support for them as much as possible.
What kind of changes have you had to make because of COVID-19?
Well, um, for one thing, the number of people coming to the office is significantly down from what it used to be. If I see 3 patients a day, that's a busy day. And the rest of the time, we're trying to spend doing telemedicine, which is an attempt to provide care, and I think I'll just leave it at that. There are a lot of people that are absolutely frightened to come out to the office. In many cases, it's appropriate to be wary of coming out. Um, and there's a lot of people that are just postponing routine care at this point in time. So we're all open for many less hours than usual and just try and make do with it as best we can.
So you talked about telehealth, and it sounds like that's not your favorite mode of communication. Are there any benefits that you're finding to the whole telehealth platform?
Well, there are a couple of benefits, absolutely. Number one is just maintaining contact with people. Being stuck in a home or an apartment with a telephone, being by yourself is extremely challenging. A video interactive is better than not being able to actively interact with a person. Do I think it comes up as good as a person to person interaction? No, not even close. But it is something. And it gives me the opportunity to at least talk to someone.
What are some of the pitfalls of the telehealth platform?
Well, that also revolves around what are some of the pitfalls of trying to practice medicine in the time of a COVID-19 pandemic.
Yes.
Because number one, the big concern on top of everything else is, do I have COVID-19? If not, everything else is easy. And we are looking at people who are ill and saying, you don't have COVID-19. But that doesn't necessarily mean we're able to fully pay attention to what's making them ill. There are other problems that go on that we tend to ignore or sideline because they are not the overwhelming fear of the moment. So if I have a patient, for example, with underlying severe chronic lung disease who calls me saying, I've got a fever and a cough and I'm a little short of breath beyond my usual, the only thing I'm going to start with is, let's get you tested for COVID-19. The question is, what if the test comes back negative? What do we do then? What do we do in the meantime, waiting for the test to come back? At this point, we're fortunate. Testing through the Nuvance health system has come down to 24 hours. So we're getting responses the next day. Initially, it was 6 to 8 days for the test reports to come back. So we're able to work with that. There's a tendency to forget the other issues in the face of the overwhelming one of where do we go if this is positive? And that becomes its own problem because I'm telling people, unless you are in extreme distress, you don't want to go to the emergency room. You do not want to be in the hospital. So how can we keep you halfway comfortable at home during the process of being miserably sick?
What are some of the options for people like that?
Um, as much as possible, we'll prescribe medications. We can get, to a certain extent, home health agencies, the visiting nurses, to help us out. But it's limited. Getting people in to see the specialists at this point in time is very difficult. Right. To get someone to see a lung specialist if they are not being immediately challenged, I'm not even having them make the call.
Wow.
You know, if somebody is in distress, then we've got to deal with it. Unless they are in extreme distress, it's okay, what can we use on the home side to help maintain?
Right. Right. So I know that you've had to make a lot of changes over the years with technology. And I wonder, what are the changes that have been helpful to you over the years that are helping you with your patients?
Over the course of the years, I think electronic prescribing has been a plus. I think to some extent electronic scheduling has been a plus. Electronic medical records are a curse and a benefit at the same time. They allow us to be totally overwhelmed with irrelevant information regarding what's going on at the moment.
Where is that information coming from?
Oh, everything that's been stored in the records for years.
Oh, okay, I see.
So if somebody's in for a given problem, I don't necessarily want to know about a test that they had 8 years ago. And dependent on the system that you have, because every system is totally different, and the systems do not talk to each other, so they are really not capable of enabling transfer of information from office to office, system to system, or from hospital to office the way you might think. I think the government really messed up when they started electronic medical records because they did not say from the beginning, every system must be capable of sharing with every other system.
So there's not one sort of
There is
junction?
no one platform that enables
Wow.
communication.
Oh, wow.
So I have no access to necessarily what goes on within the hospital. Sometimes I can get into their system, sometimes I can't. I can get parts of it, I can't get others. I have no access to information on my patients in a nursing home. I have no information to what goes on in my patients in a specialist's office other than for what they have sent me. And that unfortunately does not become embedded in and part of the record, but just stored as a file.
Oh, wow. So when a patient is seeing a specialist and the specialist asks who referred you, where do you want these records to be sent to, they may or may not get to you.
Well, that's always been the case.
Right.
But if I am fortunate, I get a faxed piece of, I get a faxed office note telling me what's going on. Then I just have to get through the 8 pages of information that's faxed to me to find the one paragraph that is of import. Because many of these records contain the last 15 visits and the last 3 years worth of testing.
Right. Right.
So as I said, information overload.
Wow. So, Ted, when all of the COVID situation began, were there any changes in your office other than the telehealth platform? What kind of changes did you have to make?
Well, of course, you had to then start working to find protective equipment for the staff. There was one point in time when I was down to 10 masks for the office, and my supplier laughed at me when I asked him to get me more. Fortunately, the next week he was able to get 4 boxes, but still, getting vinyl gloves was easier than trying to get nitrile gloves. And we haven't used vinyl gloves. Some people have vinyl allergy. So we've moved away from vinyl gloves to a chemical called nitrile, a different type of a plastic that doesn't create the allergy. And these gloves were not available. I think 2 weeks ago, I was finally able to get half a dozen gowns for the office. For the last 2 months, I've been ordering the Purell type sanitizers. Last week, I got 4 a case, and this week I got a case. So it's to say that the supplies are available to some extent, perhaps, as readily as they need to be, not even close. But then trying to get the mindset among the staff that we do not want to see somebody who's coughing and wheezing and short of breath and running a fever, or might have flown in from a foreign country, or might have a relative who's been tested positive. And trying to maintain space in the office so nobody is closer than 6 feet from each other. And trying to help the staff figure out how are they going to come to work when their children are not in school.
Yes. What accommodations have you had to make?
I've got some staffers that are coming in on a much reduced schedule because these are the only times they can get coverage. I've got others that are leaving early because they need to get out to be able to reclaim their children. It's been difficult. And of course, dealing with the fears that they have of potential exposure and what they're going to bring home and share is a totally different level of concern.
Where do you see any of these changes continuing for you because they're things that you like and they're things that are useful?
There are very few things that I like or find useful about the changes. I went into family medicine because I like to interact with people, and interacting with them is extraordinarily challenging over the phone. You can't do a examination over the internet with the current equipment that we have. It's difficult to see somebody gasp when I put a cold stethoscope on their back when they're talking to me over a screen. And it's difficult, as I'm sure you have experienced, to comfort somebody without being able to touch them or hug them.
Yeah.
I had someone the other day who was dealing with a neurologic issue on top of being in the midst of cancer chemotherapy.
Mm.
And she apologized for crying. And it's like, how can you apologize to me for crying? How can you not be overwhelmed? And were she in the office, I would have been able to perhaps just touch her and share. As it was, all I could do was try to empathize. And as you were sharing with me earlier, you've had to do a number of funerals. How hard is it to provide condolences in this fashion? I was at a conference many years ago, and the doctor said something that stuck with me for over 30 years now. He said, people come to see you not because of disease, but because of dis-ease. And that is a huge part of what family medicine, primary care medicine is about, dealing with dis-ease. And to say that in this time of pandemic, we're dealing with a tremendous amount of dis-ease on top of severe disease. So a lot of what I've been doing, in addition to trying to tease apart what is a real exposure, what's significant disease, what is, yeah, you've got it, and if this is the worst you get, you're in great shape. But dealing with parents, grandparents, great-grandparents that are not able to connect with family other than over the internet.
I
And
think
that's
that
tearing them apart.
I think that is um, the most disheartening thing about this whole situation is just not being able to touch someone,
We know
someone.
that social isolation has been a major problem for people for years. It impacts on their physical and emotional well-being. And we have just totally magnified this with the pandemic. We're creating more. Now, I will grant you, everyone is willing to acknowledge on a rational level, yes, I can understand why we are doing this and why this is important. But it still gets them here.
Yeah. Yeah. Has the public health system um, been helpful, been useful in your practice?
In terms of helping to supply information, absolutely. When this started, I was on the phone with Laura Vasile at the Bethel Health office probably a couple times a week, just trying to figure out how are we going to respond? Is this what I heard from here real versus what just someone is bringing up at this point? Yes, they have been useful. They are a resource, and they are feeling as overwhelmed as the rest of us trying to figure out how are we going to get through this.
So when patients call you or ask you for advice about what may be the beginnings of opening up restaurants, salons, nail spas, things like that, what kind of wisdom are you able to give them?
Based on what I'm hearing this moment, again, what it comes down to is I'm trying to follow the advice that's being passed along from the CDC. And I think there needs to be a balance between opening up and restarting the economy and worrying about, is this going to cause a huge jump in people becoming ill? I'm not sure what that balance is going to be. I think, currently, I think in Connecticut, it's still the end of May where it's planned. I wouldn't be surprised if that's pushed back by a couple of weeks. I'm not sure where we're at the moment.
Right.
I would love to be able to get out again. We went for a ride today and just enjoyed seeing a different set of greenery.
I get
But
it.
when it's bad, when the first thing you look at when you start up the car is not do you have a full tank of gas, but do I have my mask and gloves with me?
Exactly. Exactly. So, what kind of hope do you have for moving forward?
Okay, at this point, we were coming down to my personal thoughts as opposed to any thoughts that have been promulgated from on high. I believe that we are going to have an episodic sort of a virus that's going to come in the same way that the influenza comes. I think we are going to be at risk from this disease until such time as we have a vaccine available. And you hear that they've got a couple of vaccines now that show promise. I certainly hope so. It's certainly far ahead of what I was initially expecting to hear. Will these prove efficacious? Will they prove available? Will we be able to get adequate supplies out in time to immunize the entire population? This is an infectious enough process that we probably have to immunize 90% of the population before we're going to be able to say we have enough herd immunity that we don't have to worry about this sweeping through communities, states, nations again. Will it happen? I absolutely believe it will. We've been able to come a lot closer to working with this virus than we have with some of the others that are out there. When is, of course, the question.
Right.
And how do we handle it until that point in time? I don't think there's necessarily going to be a good one answer as much as a series of compromises.
Understood. Understood. Wow. Well, God willing, all of the scientists that are putting together some of these vaccinations and other things coming out of laboratories will bring some answers.
Hopefully, indeed.
God
Hopefully,
willing.
indeed. And hopefully, we'll reach the point where we have the ability to do a test and say, yes, you have an antibody, and yes, this means you are immune. As of now, we're starting to be able to say, yes, you have the antibodies, but we still don't know what that means.
Right.
That's very frustrating.
Yeah, very true. Well, Ted, thank you so very, very much. I appreciate your taking the time out of your day. I appreciate everything that you're doing, certainly for the Bethel community. And God willing, there will come a time very, very soon when we'll actually be able to shake hands and give hugs.
I look forward to that.
Absolutely. Ted, thank you again. Have a wonderful afternoon. Love to the family.
You're most welcome, Penny. Take care now.
Take care.
Bye bye now.
Bye-bye.